So we started about CVA, cerebrovascular accident. So we discussed everything in detail. Okay. So basically, whenever a patient of CVA comes to your clinic, what you have to do? Okay. First, for any case, detailed history is very important. So let's start with this. How to take a case in your clinic. Okay. So we'll discuss and treatment, and we will talk about two important things here: GCS and power examination. One is whenever a patient comes to your clinic, you have to ask the patient a present complaints and history, past history, okay, and present history, past history, and on examination, you have to examine and systemic examination. Okay, this is very important, and neurological examination. If the case is severe, so the complaint, the patient will come to your clinic with the weakness of upper limb and lower limb, right? Okay, right side upper limb and lower limb. First complaint is that. Second complaint is that the speech, difficulty in speech. What are the complaints? Weakness, upper limb and lower limb, right upper limb and lower limb, right upper limb, lower limb. First complaint is that, and second complaint is that speech difficulty or difficulty in speech, whatever. These are the two complaints. Now complaints. From how many days? Since 2 days. These complaints are seen in the patient. What is the history? Okay. Present history. Present history means since 2 days, the first complaint started till now, what happened to the patient? How he started, when he started, and what they did. Everything you have to mention. Like a 70 years male patient with history of sudden sudden weakness in right hand or right upper limb and lower limb. Started at 1 a.m., midnight 1 a.m. on 11th November 2024. Followed by, this is the first symptom started. Then what happened after the weakness? What happened? He had one episode of, like that you have to write. Okay. Allopathy doctors are will write in detail like this. So if you mention all these things, this is very important, and you will get proper diagnosis also. Followed by, now after that, what happened? One episode of vomiting. Okay. What is the vomiting? Vomiting is watery vomiting or food vomiting or pus or any mucosal vomiting. You have to mention. And only one episode. Okay. Yeah, you are mentioning here. Very important. After that, what happened? Then the patient, after the vomiting, what happened? The patient is unable to walk, and started speech difficulty. Okay. So this happened on 1 a.m. Suddenly, 1 a.m. what happened? He want to lift his hand, he want to lift his leg. He's unable to lift his hand and leg. Then afterwards, what happened? Vomiting happens. Then after vomiting, he is unable to swallow, also speech, and he unable to walk. Okay. So what happened? The patient he shifted to further hospital, okay, or any clinic, or else he kept in the home itself. They doesn't know about paralysis or CV attack. So they think might think that he will be okay in just in after 1 hour or 1 or 2 hours. Okay. So those things you have to write. So this will come in present history. Then we have past history. You have to ask the patient what are the past history. Means he have any diabetic, hypertension, thyroid issues, any accidents, trauma. Okay. These are the things you have to ask. And social history like he is alcoholic or smoker or tobacco chewer, anything you have to ask. So this is everything will come in past history. Now the patient came to your clinic on examination. It's very important. In the on examination, we have two types of examination: general examination and systemic examination. In general examination, what you have to see the patient is conscious or not. Okay, the patient temperature, BP, pulse rate, respiratory rate, SpO2, weight, everything you have to check this. Systemic examination will start with you cardiovascular system, check the heart rate and check the heart sounds, respiratory sounds. Is there any effusion is not there, any fluid is present in the respiratory system. Okay. And you have abdominal or digestive system, respiratory system, urinary system, every system. You have to go through each and every system and ask the patient. Okay. Then it is a systemic examination. Now, this is the case of neurology. So that's the reason we will do neurological examination. In that, two things very important. One is GCS scale, one is power of muscle. So we will discuss both of them within the minute. Please wait. So now we will discuss the GCS and power of muscle. So this is called Glasgow Coma Scale, GCS. So on this basis only the the patient is treated in neuro centers or neurological hospital. So basically we will have the scale here. In that we will give the scoring to the patient according to the scale scoring. The patient is treated. Okay, if the he is having mild attack 13 to 15, okay, he can be treated in the room side or in general ward, no issues. Moderate is according to the it will decide doctor. Mostly mild cases are treated in the general ward. Moderate means sometimes he needed ICU without any respiratory support like ventilation, oxygen, anything. Mostly, but in the severe cases, most of the patient below 7, 6, they needed ventilation or oxygen support. along with treatment in ICU and upper level of treatment he needed, sometimes surgery also. Okay. So here in this, we are giving 15 numbers or 15 marks for eye opening, verbal, and motor. For eyes, for verbal, for movement. So for eyes, we are giving total score 4, verbal, total 5, motor response 6. So we got to 9 plus 6, 14. 9 plus 6, sorry, 15. Okay, 15 marks. So in that 13 is mild, 15 to 15 is normal person like ourselves. Spontaneous means eye opening is there. Okay, patient is whenever you are talking, say he is saying to you towards you. So he will respond to your speech. Okay, he will move his eyes wherever he wants. Normal. But whenever you are giving sound, then only his opening eyes means one number you have to minus from 4. That is 3. You have to give the score 3. If the patient is in sleeping mode, when you are giving, you are pinching or with the sound he's opening means it is 2. There is no eye opening with the twisting, with the sound, means it's 0 or 1. Okay. Next, in the verbal response, now you are asking, he is telling his name, his area, his place, where he brought it, his related about relatives and what happened to him or her. Okay, everything in detail. Detail. Okay. So this is oriented, means normal, normal orientation. Confused means the patient is, if you're asking something, he's in confused state, difficulty in uh, speech means he's thinking, sometimes giving right answer, sometimes giving wrong answer. So it is confused. Sometimes this is you have to give 4 score. Only words is there. Okay. He's not giving any confusion answer or some normal answer. If sounds is there, half of words is there. You have to give 3 marks. Like sound is there, only sound, verbal. There is no words. There is no confusion. There is no orientation. Means sound 2. If it is none is there, 1. Okay. This is very important. So next is motor response, normal walking. You are telling him to lift the hand, he's lifting. Here you have to shake the hand, he's giving shaking hand. Okay, if you want to ask them to lift anything, he's lifting. Means normal 6. Localizing means only movement is there. Okay, means uh normal flexon, normal he is healthy. Okay, flexon is not there. Okay, abnormal flexon like stiffness is there. Means 3. And he his extension patient is like his upper limb and lower limb is mostly fell down, means he's 2. None, 1. So depending upon this scale, the neuro doctor will decide what he want to do. Okay, I hope you understood this. Okay, next, power, muscle power scale. This is very important while examining the paralysis patient. You have to check this muscle power. If there is no contraction, if you are lifting the hand, it is falling down. If you're asking to lift, no, this is the 0, 0 power. And he's lifting the power and grip, giving the hand for shaking means normal power. What is 1, 2, 3, 4? 1 is only movement, some finger movements are there. Okay. And he is able to uh, give some part of the hand, some part of the leg, having some movement. That is 1. There is a movement. He's he is not able to lift the hand, but is like doing swap. Okay, like that thing he's doing means there is two number, and he's lifting the hand, and his this is falling. He's lifting the hand again, is falling. This means three. He's lifting the hand, and you are giving pressure against gravity. Against gravity, he is unable to. He is lifting the hand. Means this is four. Okay, so this is how you check the muscle power of the patient. Any no movement, zero finger movements, or any part of the hand or leg is one. Okay, active movement means try to lifting the hand and it is falling down. That is two. And he are lifting the hand, but there is if you are like you are giving some pressure, it is falling down. This is three. Lifting the hand and you are giving some pressure also. He is trying to give pressure to your hand. It is four. That is okay. So this is how we check the muscle power. So this is muscle power things. You have to understood about that. Now we will talk about the treatment part in electrohomeopathy. So basically in electrohomeopathy, what is paralysis? CVA. Basically, we know that we have three things: the organs which produce blood and lymph, which utilize blood and lymph, which purify blood and lymph. So brain or nerves are utilizing organs of blood and lymph. Means here production is any issue. So that's the reason there is a problem. Production means here liver or bone marrow. Okay, first thing. Second thing is that utilizing means brain itself is not utilizing. Due to that reason, there is a paralysis. So brain and PNS and CNS both are not functioning properly. So we have to take care of this too. Later on, what will happen? The damage occurs. You need to purify also that area. So if the chronic means the purification needed, so first we will do purification, then we will have improve the utilization of blood in that part of area. Then we have to produce normal blood flow to that area to not occur the problem, reoccurrence will not happen. Okay, so these are the three things you have to remember. So basically, if the lymph is not involved, then the problem will solve very easily. But if the lymph is involved, then there is a deeper issue. You need to more focus. Okay, first you have to purify the blood and lymph. Then you have to improve the blood and lymph utilization. Then the production also improve. Okay, blood and lymph. So you need to treat whole body. Okay, so you need to treat whole body in that case, yes, in that scenario. So and that is very complicated or time needed problem. So depending upon the affected area, affected path, okay, like I will give 6 marks. If the blood is affected, 1 mark you have to treat. Blood utilizing organ is affected, next plus one. Or purifying agent is affected, then one. Blood lymph producing organs are affected, plus one. Lymph utilizing organs are affected, plus one. So likewise, you have to give the marks. If it is below three, you can treat the patient easily, and sometimes very rapidly it will give the result. If below more than three, more than three, and between five, it will take moderate to severe time to recover. If it is five or above 5 to 6, it will take more than what we think. Okay. So I need the treatment according to that. So likewise, you have to design the treatment of the every disease, whatever disease in electrohomeopathy, you have to design like that the treatment of the patient. Okay. So here what happened? So I cannot tell you that one treatment will give the benefit to the patient because we don't know the how much amount of marks you will give. So we will basically will focus on two things: blood making organs and blood utilizing organs. So if the problem is in these two area, so we will give this treatment. Okay, because I already told you improve the blood S5 A3 RE. Okay, very important to improve the blood production, blood quality. Okay, and the second one is F1 because utilization you have to improve. Okay, regeneration of nerves to be happen. F1 when one Y. Next, this is the regeneration. Next, F1 S1 WE to improve the nerve quality. F1 is the master remedy of nervous system. S1 is a remedy of digestive system or lymphatic temperamental remedy. So likewise, you have to improve the lymph and digestion, metabolism of the nervous system. Along with you have to give nervine F1A3RE. Not only we have to improve the circulation to the blood organs, also to the nervous system. Okay, F1A3RE. This is very important, and the patient will have pain sometime, stiffness, anything is there. According to the symptoms, we can add the remedies. For application is very important. Right side is affected. You have go to through F2RE, or left side is affected F2YE. You can add another thing also. Left side, 8 or right side, sorry, right side we have A2, F2, A2, RE, or WER2 also is there. According to the severity, you can add this also, or in place of A2, A3 also. Very good. But we will give A2 for the right side. Left side, A1, F2, YE plus A1 plus WER2. Initially start with F2YE, F2RE. Okay, you can give apply the F2RE oil form or directly D4 or D3 and D4 or D5. Okay, and you can give bath with that. Okay, so all will give a wonderful results. Other than that, you need to focus which level of disease is that. But this treatment will help you, but according to the condition. Okay, if it is acute, give in D6, subacute D5, chronic D4. Okay. So along with that, you have to give the passive movements to the patient. Means exercise, physiotherapy, because our body the is made okay is made for movements, movements. So if you doesn't do any type of movement, what will happen? The pain. If a normal person also, if doesn't move this hand, what will happen? It will become stiff and it will become painful. If you sit like that for 1 hour, your every back will pain. Okay. If you sit like that, your legs will be painful. So you need to movement because muscle or bone or nerve is stimulated by the work itself. Okay. So passive exercise is also very important for paralysis. Okay. So you need to understand this. Okay. Passive exercise is very important. Along with diet is also very important if it is hypertensive or diabetic. Okay. Everything you need have to note down and follow according to that. So this is about that. I think you understood. So we will start